Our next Weezie's angel is Denise Covell from Northeast Baptist Hospital. First of all, welcome and congratulations.
Well, thank you so much. I'm very honored to be nominated, so thank you.
Well, not only nominated, but you're a winner too. What do you think about that?
Oh, I didn't know that. Oh, I'm very flattered and very humbled because I really give the credit to the staff on the floors for everything that's happened during COVID. So I'm very honored and humbled to be nominated and win the award. So thank you.
So you are, it's infection control preventionist. So this is basically something that almost, right up your alley, obviously, right?
Yes, so the infection preventionist, there's usually one in every hospital, and our main job is to keep the facility safe, monitor for infections, outbreaks such as the coronavirus. So when we monitor things with the CDC, and as we find out novel viruses are coming out or flu is coming out, part of our job is to get the facilities ready and prepared to deal with such influx of infectious diseases. So that's part of what we do. So back in January, I started learning about coronavirus that was coming out of China, and it was a novel coronavirus. Coronavirus has been around for a long time, but this one was a new strain, and they were showing to have person-to-person transmission. So it made me very worried that we had a new virus that was coming out. So in January and February, I started getting the facilities ready, prepared to what are we going to do should this patient walk into our facility.
So you, before really it even, hit the news and everybody, the rest of us started getting locked down, you were already got the ball rolling and got everything moving.
Yes, sir. That is part of my job. I get things ready to go. So I ran through drills with them, with the people at the entry points, going over with them, the people we were looking at. And at that time, it was just those coming in from Wuhan, China, because that was the hot spot. And then I would walk them through, what are you going to do when this patient comes in? And so we talked about putting a mask on the patients, isolating them away, and then notifying the rest of us so we could jump in and figure out how to take care of this patient. We designated certain areas in the ED where they would go to be isolated from everyone so we could take care of the patient. But then we got the cruise ship that came into Lackland. And that was the game changer right there when we got the cruise ship coming in. And so our downtown facility was the first facility to receive these patients. And so I went downtown and helped them set up the rooms appropriate for these type of patients. And we did take care of those patients there downtown, make sure they had the negative pressure. Everyone had the appropriate PPE and everything. So we did all of that. And then it really started spiking up, and we were in touch with the health department. I keep in close communication with the health department on everything that's going on, so I can let the facilities know, hey, we need to start getting ready for this. I started getting the hospital ready for, okay, so what happens when this location fills up? Where else are we going to put them? So we had to do a lot of work on the front end to get rooms ready, put them in negative pressure. We had to get facilities involved, EVS involved, nursing involved, supply chain involved, because we were looking at PPE, we were cleaning, keeping the air, because we didn't know at the time exactly how this virus was transmitting. So we put everybody in negative pressure just to keep them safe.
Yeah.
And then
along with all that, reading about it, specimen collection, traffic patterns, signage, education, basically the health of the hospital is on your shoulders.
Yes, sir. Yes, sir, that is correct.
Along with all that, though, do you also did you have to be the cheerleader?
Yes, I had to, we had to keep them going. And not only am I looking at the health of the hospital as far as facilities go, but the nurses and the staff with their mental and physical and emotional needs, because it took a toll on them as well. We were seeing patients coming in, and when they were testing positive, they were being intubated fairly quickly. They were in the ICU. Some of them didn't survive. And nurses and healthcare professionals were used to dealing with death.
Hmm.
But when coronavirus came in, we called it death on steroids because people were just dying so quickly, and it was taking a toll on the nursing staff, on the physicians. So, I worked with chaplains to safely uh, bring in family members who had families that were dying so they could at least say their last goodbyes. So we had to do that coordination well, and I had to think of, how do we do this safely? How do I let them come in to see their family members or be able to see them via phone call or anything like that? So it was a lot of team effort because it was more than just the transmission. It was also the mental and emotional part of coronavirus.
The nurses that I've spoken with have, they said, oh, I'd do it again. It's part of nursing, and it's their job to take care of, obviously, the patients. And like we're saying, it's your job to take care of the nurses and everybody under the hospital roof. Was it everything from just a smile and a hug and a pat on the back to what else did you do?
Oh, so with them, I talked with them a lot. They called me at all hours of the night. I had my phone on 24/7, and they would call me all hours of the night. This came in. What do I do about this? This happened, especially when the first patient expired. What do I do? And I'm like, okay. And I would walk them through it. This is what you're going to do. Do this, this, and this. I'd come in early, stay late, just being there with them as a resource. And I think that helped them because they knew if they weren't sure about something, they had my personal cell phone number, and they
Mhm.
were on the phone with me, and they were calling me, and I was going back to my CDC guidelines. Okay, this is what they're saying we're going to do, this is what's safe. And so it was very intimate relationship between myself, and not just the nursing staff, it was all of the healthcare workers here. So it was a lot, and it was very meaningful, and I think they finally understood what your infection preventionist does for your facility.
Okay, so you took care of them. Who took care of you?
Me took care of now. I will say my admin team, my leadership here was very supportive. We have a team of IPs, so we all would have our little group chats together, talking about things and venting with each other. My leadership here, my CNO, my CEO, COOs, they were very supportive. And anytime we were like just tired, they're like, it's okay, take a break, do what you need to do, and then come back. So they were very supportive, and my family too, very supportive. They know, and I'm also a reservist as well in the Air Force, so they're kind of used to. They're very supportive of the
Yeah.
things I do, and so it made it a lot more bearable going through. This is my third pandemic as an infection preventionist, and this was probably the most stressful out of all the pandemics I've been through.
Well, first of all, thank you for your service, not only there but in the military. What's your family think about this award, though?
They're very excited. I have my son. He's just now going into sixth grade, and he was very happy. He told his school on their little Zoom meeting about his mom, so he's very excited. I have a daughter who's up in Bryan, Texas. She's going to college up there, and she tells me, "Oh yeah, mom. Anytime they have questions, they always ask me, so I can ask you." And I'm like, "That's fine."
So you got the hospital, and then you got all of A&M up there.
I do. I do. So they're very they're very happy and supportive of me. And like I said, I had no idea about any of this, and I'm very humbled because I feel um, I did a lot of the behind scene work as a team with other people, but the staff out there front lines really just did a lot, and I could never thank them enough for all the things they did and the great care that they gave everyone. It was it's very beautiful to see everyone come together.
Thank you, Denise. And again, congratulations.